Hello, my name is Seth. I'll be your nurse practitioner today. I'm going to enter the room, perform hand hygiene by washing my hands. Do I have your permission to record this, put it on YouTube for grading purposes?
Yes.
All right, we're going to do a quick respiratory assessment today. Do you have any respiratory symptoms, shortness of breath, chest pain?
No.
Good. So first thing we'll do is we'll do a quick inspection of the anterior and posterior surface of the chest and back. We're looking for multiple abnormalities such as excavatum, which is a sunken chest, and carinatum, which is a protruding chest. We're looking at your AP ratio, which is 1 to 2, meaning the width of your thorax and chest should be twice the depth, which yours is, which is a normal finding. We're going to look at chest rise and fall. We're looking at your rate, should be between 14 and 20. We're looking at the depth of your respirations. Making sure that there's no accessory muscle use, no retractions or anything like that. Now, these all appear normal. We're going to inspect your mouth and lips and your fingernails for cyanosis and clubbing in the nails. We're looking at that deep blue coloring of the mouth, which is secondary to hypoxia sometimes. And I don't see any of this. So this is good. And again, like I mentioned earlier, we're going to look at the back for respiratory rate, depth, all these other things. After we've inspected, we're going to go ahead and palpate. We're looking for costochondral tenderness. Do you have any pain when I palpate here?
No.
Checking for crepitus, any air that has escaped into the subcutaneous tissues. It doesn't appear so. While we're palpating, we'll also go ahead and we can check our respiratory excursion. I'm just going to put my fingers right here below your lung base, push it together just a hair, and have you take a deep breath. Good. And I'm making sure that my hands move together and they both move medially and upward. And this indicates proper chest rise and fall. We would do this also posteriorly, and we'll try to remember to demonstrate that for the camera when we turn you around. I think that's good for the palpating portion. Next, we're going to percuss all lung fields. The anterior surface has 12 lung fields that we want to percuss as well as auscultate. So we're going to start up here. We're going to use the third finger of both hands, and I'm going to put my third finger of my left hand and strike it with my third finger of my right hand. And we're going to use the ladder technique just like we will with auscultation. And that sounds good. We're checking for the resonance. Resonance indicates air, which is exactly what should be in your lungs. Any dullness, I may be over a bone. But if we're sure that we're not, because we're doing this in the intercostals, then we hear dullness. This can indicate an abnormal lung finding, such as fluid, blood, pus, infiltrates, consolidation. We would also do this posteriorly, and I'll try to demonstrate that as well. But if not, we can verbalize it. There's 14 lung fields on the posterior surface where we would percuss as well, just like I've demonstrated. Now that all of your, so far everything checks out, seems very healthy, we're going to go ahead and take a listen to your lungs, if that's okay.
Mm-hmm.
And I'm just going to have you take a few, just take a deep breath every time I move my stethoscope, okay?
Okay.
We want to start pretty superior up here around the clavicle. Go ahead. Very good. Auscultating, we're listening for bronchi, rails, wheezing, stridor, pleural friction rub. I don't hear any of those. Everything sounds very good on the anterior surface. With that, I'm going to have you turn around if that's okay and just face the wall here. Thank you so much. We've already inspected, but we'll inspect again. We're looking for even chest rise and fall, which you are displaying. We're palpating for any tenderness, any crepitus. We're going to do our respiratory excursion. I'm going to put my hands right about here, try to move out the way of the camera. Put a little bit of skin together, have you take a deep breath. Good. And the hands moved medially and superiorly with your chest wall movement, which indicates bilateral rise and fall. We're going to go ahead and percuss. Very good. Those all sound fantastic. I could actually, leads me into my next exam, the diaphragmatic excursion. I could hear your resonance become a little bit higher right down here once I left your lung borders. So on that note, we're going to check your diaphragmatic excursion. We're just going to do it on the left side for the sake of time, but we would do it on both lungs in the office setting. What we're going to do is we're going to percuss down, right here to the most inferior portion of your lung base. And I'm going to have you take a deep breath and hold it, and I'm going to percuss again to find that lung border while you've got your breath held, okay? So go ahead when you're ready. So right about there, and I would mark this with a pen. With your back exposed, you can breathe normal now. So we know where your lung base ends when they are fully expanded. So go ahead and catch your breath. And then when you're ready, take a deep breath and exhale completely. Empty out all the air from your lungs and hold it. Very good. Right about here, I hear where the octaves change, and I would mark that with my pen also. And then we would measure between these two. Normal lung change should be about 3 to 6 centimeters. For healthy adults, maybe athletes, it might be a bit bigger because their lungs expand further. But yours is perfectly normal between 3 and 6. So that's your diaphragmatic excursion checks out just fine. Next, we're going to make sure to auscultate. So important to do. We've got 14 different fields, and just take a deep breath every time I move. All right, that sounds great. Keeping in mind, as we use our ladder technique to auscultate all these fields, we want to try to do it exactly on the same side, the same distance apart from the spine there. That's just a good location, marker point, I guess. But everything so far sounds good. I think there's only one last test that I'd like to do for you, and this is called checking for egophony. And I'm going to listen to you just like I've been doing. And all you do is just verbally say the letter E. And I'm checking to hear if it changes in octaves or sound. If I hear your E start to sound like an A, this can indicate consolidation in the lungs, fluid buildup, pus, blood, edema, things of that nature, all of which are abnormal. So I'm just going to take a peek. And go ahead and say E.
E. E. E. E. E. E, 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 E.
All right, that all sounds good. We would do this on the anterior portion too, the front, but for the sake of time, we'll just verbalize that. Also, I want to check one other thing. We need to check your tactile fremitus Normally we would do this a little bit earlier in the exam, but it doesn't make a big difference if we do it at the beginning or the end. So tactile fremitus is a test that I'm feeling for the intensity of vibrations as you say the word 99. For the posterior surface, we can use the palm of the hand. I'm just going to keep it congruent. On the front, we would use the edge. So just say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Very good. And the intensity of the vibrations felt the same throughout. This is a good finding. That means that your lungs are full of air and not any other abnormal. An increase in vibration can indicate inflammation. A decrease in vibration can indicate fluid buildup. So I'm going to have you turn around one more time just so that we can demonstrate for the camera the tactile fremitus on the anterior surface. Again, we would have done this normally earlier in the exam, but it's okay to do it now as well. So go ahead with the 99.
99, 99, 99, 99.
Perfect. And I'm going to have you use the back of your hands to lift up your breast tissue. Perfect.
99, 99, 99, 99.
All right. Everything felt perfectly normal. So that sounds like a very healthy respiratory exam. I believe we've covered all our bases. Do you have any questions?
No.
Thank you so much for your time.